Welcome to Path to Prevention and today's topic, Annual Wellness. Grace Health's mission is to provide patient-centered healthcare with excellence in quality, service, and access. We also strongly support preventative care to keep you on a healthy path.
All right, well, hello everyone. Welcome. We are saying hi from Grace Health today, wanting to talk a little bit about preventative care and a path to prevention. So my name is Alicia Morris. I am a Director of Patient Services here at Grace Health, so I oversee all things scheduling, access, and registration. And my partner here is...
Hi, my name is Courtney Kernstock. I'm a physician assistant with the family practice side over here at Grace Health. I work here at our main site and over at our College Street location.
So we are here today to talk a little bit about, of course, Grace Health, what the services that we offer regarding preventative care. We are a patient-centered medical home. And so what that means is we do everything we can to put our patients at the center of care. So we have a care team neighborhood concept where our patients are put right in the middle with our providers, our registration staff, our clinical support, MAs, nurses, the whole gamut. So we offer a variety of primary services along with several different specialty services. So we're really here today to talk about just the importance of that preventative health and making sure that we're getting things taken care of before we get sick, right? So what we do here at Grace Health is we're really focusing on the continuity of care and the coordination of care, and that's where that care team and what we call neighborhoods concept comes into play. So Grace Health's mission really is to create a community where all people can achieve their full potential for health. And they have well-being across their entire lifespan. So we have those reaches out to the community, and we can be a trusted partner, if you will, with our patients, where folks can come in, feel comfortable at home, and safe to be able to speak to our staff and our providers about what they need to take care of their preventative care.
Thank you, Alicia, for that great introduction of what preventative care is all about. And you're right, we want to bring the community together. We want to be here for your health needs. And what that means is this is across the lifespan, like Alicia said, all the way starting from newborns up through our most elderly patients. I've even seen patients over 100, and I encourage them to come in, continue preventative screenings. It's extremely important in what we do, and it's the heart at what we do in primary care here at Grace Health. So some people may wonder what's involved during an annual physical and what does that mean for them as a patient. We go over a great deal of information. It's really unique per patient. We want to have a good conversation about what preventative screens you're due for, your family history, and what you may be at risk for based off of family history and other chronic conditions that we would treat you for. This warrants a really good in-depth discussion with us so that we can treat you the best. Now, it may range based off your age, gender, what we may be screening for. And just a short list of some of the things that we screen for instance, would be mammograms for breast cancer screening, cervical cancer screening, for cervical cancer risk, colonoscopies for colon cancer screening. We may even do lung screening as well if you have a history of long-term smoking, for instance. So there are a lot of things that we discuss, and that's even just scratching the surface, but we want to have those good conversations with you to make sure that we have your health going in the right direction, because that's the heart of what we do here in primary care. In addition to that, we also like to do a good thorough exam for you. Make sure that we're looking at your ears, nose, throat, listening to your heart and lungs good, doing good thorough skin checks. These are the things we want to capture and make sure that we're looking at before we have any other concerns arise with your health. We want to catch things, and that's what prevention is all about. In addition to that, we also discuss healthy lifestyle. For instance, exercising, nutrition, what other things can we do to help you be your healthiest and live your best, healthiest life, really. And we want you to be comfortable talking to us. We are here for support. We want to have this open dialogue and these open conversations, and we want you to come in and see us. So leading into that, as we said, we do take care of all patients from birth all the way up. And so I want to talk a little bit about what that preventative care means for our pediatric patients, because they're just as important as our teenagers, adult patients. We want to give everyone the most comprehensive care possible. So keeping in mind, with well child exams, they are a little bit more frequent, starting from birth on to 3 years old, and then they would be yearly after that. But we want to encourage families to bring in their children for regular exams. Again, this is just as important as our adults. And our little kiddos can't always speak for themselves, so we want to have our eyes on them, we want to listen to their hearts, we want to check their height and weight, we want to check all these things that are super important. And as they're getting older, we want them to have a voice for themselves, get used to the healthcare setting, and getting used to things and talking to us and having that open dialogue again to get ready as an adult into preventative exams. And we want to talk about immunizations, again, growth. We like to have good educational conversations. We don't want this to be a scary thing. We don't want kids to be scared or parents to be scared. If there's questions, we want to educate. Again, we really want to encourage folks to come in here because we're human too. We've all been through, our own routine exams with our own children, ourselves as kids growing up, and we want people to be comfortable.
And of course, including the feeling of safety, right? Being able to come in and feeling safe and comfortable as a patient. We want the schedule to work for you. So we want there to be good access and good availability for what meets your needs. So we have same-day appointments here available. We have walk-in appointments that are available for any of your acute needs. If you have, say, a cough, a sore throat, some ear pain, things like that. And we also have a 24 hours a day where we have nursing available via telephone. So if it's 2 in the morning and your little isn't feeling great, you can call and you can speak with a nurse, and they're going to give you some guidance about how to best take care of them. So another area that we have access and availability as well for our kiddos is our school-based health centers. So we have medical providers in 4 of our locations. That's Battle Creek Central High School, Lakeview High School, Springfield Middle School, and Northwestern Middle School. And so we're able to serve patients there from ages 5 to 21 with a full range of services. So parents, if your kiddos go to any of those schools, make sure to look into that. You just have to sign one of our consent forms. And then the kids can take full advantage of being able to be seen right when they're at school.
Which is super convenient as a parent and a patient. And they do offer full range services, anything that we would normally do here on site. Again, as long as we have that signed consent form, they essentially can treat anything at the schools. So again, we want to circle back around to what this means for our community and why prevention and preventative health matters. We want to be there for your unique individual goals. We want this to be a comfortable process for you. We want you to be able to open up to us, to determine why we're here, to keep you healthy, to circle back around, make sure you have good providers. We're a team. We want to work with you. I think we've all been there as patients ourselves, not just as medical staff and providers, and we know what it's like to be in the patient seat. We want you to feel comfortable. We want you to come in. We want to make sure that these preventative screenings are done to make sure that we keep you your best and your healthiest.
Absolutely. Thank you, Courtney. So if you guys have questions and you want to know how to get in to see us, give us a call. We have appointments available readily, so you can contact us at 269-965-8866. That's going to take you through all the different options, all the different areas that you can get an appointment for. You can also go on our website, which is gracehealthmi.org. And you can request appointments on there as well. So there's several different platforms for you to be able to get in touch with us and schedule some appointments.
Thank you, Alicia. And one thing I do want to add is that if you're already a current patient here, you can access the Grace Health website to access our patient portal. And that way you can actually send direct messages to our team members, providers, and that way we can see a direct message from you and send it right back. So it's sometimes an easy form of communication, and we like to make your guys' lives a lot easier.
All right. Well, thank you for hearing and listening to everything that we had to share today. We look forward to seeing you at your next visit.
Thank you.
Thank you for joining us today. Grace Health's vision is a community in which all people achieve their full potential for health and well-being across the lifespan. We are a patient-centered medical home We put our patients first, and we continuously strive to improve care.